Hi, I'm Chris Lindley with Eagle Valley Behavioral Health, and I'm here today with Michael Holton.
Hi, I'm Michael Holton from Bell Health.
Awesome. So we're here to give you a couple updates on what we're doing, but please stick around for the whole video, watch the whole thing. Michael's going to be announcing two huge announcements that we want to share with the whole community, but before we get to that, I want to tell you a little bit about Eagle Valley Behavioral Health and why we're doing this. Okay, first off, Eagle Valley Behavioral Health is a collaboration of many partners. This is just some of the partners. We're actually working with everybody, including you. The goal of Eagle Valley Behavioral Health is to build a brand new behavioral health system in this community that serves the needs of every single person living in this community and in the future become sustainable. So in the future, we're not out seeking grant dollars and donor dollars to keep it running. We want this to be a sustainable system moving forward. Let's talk about what's going on so you understand the need and why we're focused on this. In the last 2 years, we've seen a threefold increase in suicides in this valley compared to historical numbers. What this looks like on a daily average is we average almost one suicide attempt per day in this valley. That's 44,000 individuals, almost one a day, 324 last year. We're seeing this in the ED, and Bell Health is not alone. We're seeing this across the whole country, a 465% increase in just 4 years for anxiety and depression. Eagle Valley Behavioral Health is not just about mental health. So what behavioral health is a combination of mental health and substance abuse. One of the substances we're most concerned with in this community is certainly vaping with our children. 60% have tried vaping in the last year in our youth. So it all comes down to why are we seeing these issues? Well, one of the things that we've realized is as we really looked at the data and looked at what's going on, we have a significant provider shortage. We actually have 1/2 of the behavioral health providers in this community as compared to the state average. The state, however, unfortunately, is 43rd in the country. So we're losing the race with a bunch of losers. And so what we hope to do in the future, and some of the announcements we're going to show you today are in lieu of pushing us there, is we are hoping to reverse this and not only be the best in case or best in class in Colorado, we want to be the best in the country as we go forward. So I'm going to hand it over to Michael to two exciting updates and announcements we want to give with you today.
Thanks, Chris. The great news is there's a couple of dozen organizations who've been working on this for 1.5 years, and Chris has done a great job in leading this effort. And more than any community in America, we are poised to reverse the trend we're seeing in behavioral health. And this county and this valley is going to lead the state and lead the nation in how to build a system to truly attack this epidemic. So one of the things that we need to do is have one single source of truth. And that single source of truth in our community around behavioral health is going to be a website that's eaglevalleybh.org, eaglevalleybh.org. And we'll show you that in just a second. To get people there and to start reducing the stigma around behavioral health, there's some very important things we have to do. One is we need to get people talking, and we need to shake the shoulders of this community and wake them up. And so we're going to do that through a campaign that is launching that is called Long Live. And let us tell you a little bit about this campaign. The Long Live campaign is summarized in this way. You are not defined by a disease, an addiction, a mistake, or a chapter in your life. Your story is not yet finished. You are not a burden. You are loved, and you have a purpose in this life that's bigger than you know at this moment. We want you to live a long, healthy life. You just need help getting through this chapter. It's time to find a therapist or group to talk with. It takes a valley. Some of these ads you're going to be seeing around, and we're going to have a whole lot. We're going to have them in English, and we're going to have them in Spanish. And we're going to start unpacking these words that often we whisper, but now we're going to say them louder, and we're going to talk about them. Long live the depressed. Your story is not yet finished. You are not defined by a condition, a past mistake, an addiction, or current struggle. You deserve to live a long, healthy life. It's time to find a therapist or support group and write the next chapter. Visit eaglevalleybh.org. Long live the abused. Long live the alcoholic. Long live the betrayed. Long live the bipolar.
So Michael, these words, they're jarring. Some people are going to be potentially a little bit offended of this. Can we talk and share with the audience what we're trying to accomplish by using the real terms here as you have presented today?
You bet. Long live the schizophrenic.
Yeah.
Long live the Adderall addict. Long live the adulterer. Like we said, we're going to say out loud words that we whisper. And some people would say these are labels that we're putting on folks. That's not what we're saying here. We're stripping away these labels. We're saying, long live the person. You are not defined by a disease. You are not defined by something that happened to you. You are not defined by a choice or mistake that you made. You are defined by the chapters in your life that we're going to get through, by your resilience to overcome these things. But one thing we do know in America is if you are a little bit politically incorrect, if we do say these words out loud and we do embrace them, it's going to get people's attention. And the whole goal of this is we must get this entire valley's attention. If we're going to shift the culture here, if we're going to reverse the horrible stats that you showed, it's not going to be from whispering about it. No. It's going to be bold. It's going to be all of us talking about this, and that's what's going to happen. So this campaign and this website is designed to shift the culture of this valley.
Let's show the viewers the website. Let me move this over. And can you walk us through that a little bit?
Yeah, thanks, Chris.
Yeah.
So eaglevalleybh.org is our site. And on eaglevalleybh.org, you can get a lot of great information about behavioral health in this community. One is you can immediately get help now. We do have a 24/7 line that you can call that's going to help you identify resources. Or we have a Get Help Now page that's going to help you kind of identify how urgent is this and then navigate where you should go. One of the most important pieces of this website absolutely is the therapist finder. So for the first time, all the behavioral health therapists in the Eagle River Valley are represented in one spot. We had a lunch with these guys and they are so excited to be working together, to get to know one another. When many work independently, now we're creating a community. So as you can see, you can tell from a therapist if they are accepting patients right now based on the green button or not accepting patients. When you click in, you can find out all sorts of information about them. You can find out how long they've been practicing. Do they do a video practice? So can you do telehealth with them? Where's their office? What is their contact information? Do they have a website? You can find out even when do they have availability. Is it mornings, midday, afternoons, evenings? You can read their bio as you shop for a therapist that fits your or a loved one's needs. Find out what languages do they speak, English, Spanish, others, the populations they serve, children's, teens, adults, couples, and others. Financially, what would the relationship look like if you were to take part with this behavioral health specialist? Is it a sliding scale that they work on? Is it an average cost per session? Do they accept insurance? If so, what insurances do they accept? Do they accept EAPs and mental health funds? And also, what are their specialties? You want to make sure you find a behavioral health specialist that knows the area that you need help in or a loved one needs help in.
So Michael, this is not a static site. So show the viewers how easy it is to keep this updated for our providers, because it's real time.
Sure. So the providers have an area where they can log in and they can get into the back end of the system and update all the material on their profile. So on a daily, weekly, monthly basis, they can come in and change what their availability is, if they're accepting patients or not, if they've moved offices. So this is a great single source of truth to direct people when they are looking for help for them or somebody that they love.
Thank you.
Some other really powerful tools on this site are our support groups. You can come in here and find out what are the support groups throughout the valley. One place to find out everything that exists. You can also get involved and find out what are the events going on in this valley. And if people don't see events that they want, on the bottom right of the website, you can contact Chris's staff at Eagle Valley Behavioral Health and get events added to there. We can find out trainings if people want to get mental health first aid, if they want to find out signs of suicide, the SOS training, the applied suicide intervention skills training, the QPR, question, persuade, and refer, and then a training that our team has done, which is the Working Minds training, which is a workplace mental health training. You can find out all about Eagle Valley Behavioral Health, the initiatives and strategies that make up the $60 million, plus the dollars that we're going to fundraise on top of that to fulfill it all. Find out about the leadership and the advisory council, the mission and vision, the news, and all about Chris's staff. We know we can find a therapist. We can get help now. So maybe it's not a specific therapist you need, but you need to find out information on addiction and substance abuse, crisis response, domestic violence and sexual abuse. You can find your therapist and find your support groups. We can see all the partners, the dozens of partners that are involved in this initiative that have been working on this for over a year. And then another really, really important part is, as we look to add 50 to 100 additional behavioral health providers over the coming years, this is one place that we're going to be able to list all the career and job opportunities related to behavioral health. So these aren't just jobs for Vail Health or Eagle Valley Behavioral Health. Really, these are jobs for all the provider groups and all the nonprofits in the community that are working in this space. So we'll have job listings for Colorado Mountain Medical, for Mine Springs, for Eagle County Schools. And when somebody clicks into this, they're going to go straight to that webpage on that other partner site to be able to learn more and apply directly through that employer.
Thank you for watching our update. I want to leave you with 3 things that you could do to really get engaged and help move this forward with all of us, because it's going to take everybody in this valley working together. Number 1, on our website, eaglevalley.bh.org. Please go to the bottom and sign up for our e-newsletter. Big updates, monthly summaries we'll be sending out through the e-newsletter so you can stay connected there. On social media, please visit us on Facebook, Eagle Valley Behavioral Health. Everything from videos to breaking news in the community. We're trying to do daily updates of what's taking place. We're also sharing all the great work that our partners are doing. So if you want to find out about training, community events, Facebook is the place to do it. And lastly, and certainly the most important, is we need you to engage in this stigma campaign that Michael talked about. We need you to have these conversations. We want you to be uncomfortable, bring these issues up, whether they're your own issues or loved ones. Let's start having the conversation so we can heal as a community going forward.
Thank you guys so much for watching us. Make sure to stay engaged. Stay engaged through the Facebook page, stay engaged through the website. We're only going to change this community if all of us are in this together.